Hi guys, today we will be talking about dangerously high blood pressure, also known as hypertensive crisis. If your blood pressure stays too high for too long, it can start damaging your organs. Extremely high blood pressure can damage your heart by causing things like heart attacks, heart failure, or damage to major blood vessels. It can also damage your brain, potentially causing strokes, memory loss, and swelling or bleeding in the brain. Very high blood pressure can also damage your kidneys, potentially leading to kidney disease or kidney failure. And blood pressure that is too high can also damage your eyes, since it can cause bleeding in the back of the eye or swelling of the optic nerve, which is the nerve that runs from the eye to the brain. So, hypertensive crisis is broken down into hypertensive urgency and hypertensive emergency. We will talk about hypertensive emergency first, as it is the more severe one out of the two. Hypertensive emergency is when your top blood pressure reading, also known as systolic blood pressure, is over 180, or your bottom number, also known as diastolic blood pressure, is over 120, and you are experiencing symptoms of potential organ damage. If your blood pressure is that high and you are experiencing such symptoms, the American Heart Association says do not wait to see if your blood pressure comes down on its own. Call 911 or have someone bring you to the hospital right away. What are these symptoms to watch for, you may ask? Symptoms that might indicate your high blood pressure is damaging your organs are severe chest pain, severe headache, blurry vision or other vision changes, weakness or numbness on one side of the body, such as in one arm or leg, trouble talking, trouble breathing, passing out or having a seizure, nausea or vomiting, severe anxiety, nosebleeds, confusion, pain in the upper back or between the shoulders, pain in the lower back or on one side of the body, urine that is brown or bloody. Again, if your blood pressure is over 180, over 120, and you are experiencing these symptoms, call 911 or have someone bring you to the hospital so they can see exactly what's going on and better take care of you. Now, hypertensive urgency, on the other hand, is not as severe as hypertensive emergency, but much more common. Hypertensive urgency is when your top blood pressure reading is over 180 or your bottom number is over 120, and you are not experiencing symptoms of potential organ damage. The American Heart Association recommends that if your blood pressure is over 180 over 120, wait about 5 minutes and try again. If the second reading is just as high and you are not experiencing the aforementioned symptoms of potential organ damage, contact your doctor or healthcare provider. Your healthcare provider may just have to adjust your blood pressure medications or potentially add a new one, but hypertensive urgency rarely requires hospitalization. As far as preventing spikes in blood pressure in the future, make sure to take your blood pressure medications as directed by your doctor. Remember, they don't work unless you take them. And second, always read your food labels for salt or sodium content. Eating large amounts of sodium can cause blood pressure to spike. For other tips on keeping your blood pressure under control, watch my other video on 10 ways to lower your blood pressure, which I will link in the description below. All right, so that's it for today. If you learned something or found value from this video, make sure to hit that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. And last thing, this video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is always changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. Thank you for your time and stay healthy. See you next time.